Go ahead.
Hi everybody. I'm here at my office, and Tiana here came to me today with her track coach, who happens to be a patient of mine, and she told me about Tiana's having shin splints. Whenever I hear shin splints, it's a common diagnosis. It's a common problem that a lot of runners have. And they say, my shin hurts, I must have shin splints. Just like all foot pain is plantar fasciitis. It's not. All wrist pain, it's carpal tunnel. It's not. There's a lot of things that it could be. And so as soon as she came in, I'm like, where does it hurt? And she points to the inside of her shin. Guess what? Shin splints don't present on the inside of the shin. They present on the outside in this particular muscle. So, and I see this all the time in runners. So there's a muscle, big fancy word, tibialis posterior. It's all, people love Latin. It's a muscle that's on the shin bone, the tibia behind the shin bone. It sits right here. And the main function of this muscle is not only to support the arch, but it also does some, so you can stand on your toes. The calf muscle is the dominant muscle that does that, but this particular muscle does that a little bit as well. It starts at the top of the shin, goes behind the shin all the way down, goes behind this part of the bone right here, which is also the bottom of the shin bone, and attaches to a bone in the foot. And when I asked her when she came in, I'm like, do you have pain here sometimes? And she's like, yeah. She kind of smiled like, how'd you know that? Well, that's where that muscle attaches. That's why anatomy is important, right? So what we're gonna do, and I see this all the time, typically the problem is usually like the size of a credit card right up here in this part of the shin. Her other leg has a 2 further down. I have seen it there, but it's less common. So all we're gonna do is we're gonna start loosening this thing. This is not even nearly as bad as this one, right? But I can tell, right? I've already kind of examined it a little bit before we started this video. So here's how this works. You're gonna feel, you see how the shin bone's flat here? If you move towards your calf muscle, you'll fall off this little edge. See how it just angles down? You're starting to get behind the shin, right? And you can feel that grittiness. It's like little balls in there, like sand, right? There's none there. That doesn't hurt at all. That's just pure bone, smooth muscle. That's gritty nodules. That's where and you're gonna feel it. Like that's tender, right? So here's what you do. This foot right here. You take your thumbs. You could use a lacrosse ball. It doesn't matter. I like using my thumbs because I can feel tactily. I can feel the muscle stretching underneath when I do this rehab. So I'm gonna take my thumbs and I'm gonna push to your tolerance. I'm gonna push the muscle into the shin. I'm gonna pinch it between my thumbs and the shin bone, diagonally towards the floor. I'm not pushing straight forward. I'm pushing down towards the floor into the shin bone. You feel that, right? Here's what you're gonna do. When I say go, you're gonna, if you have this mobility in ankle, you're gonna evert the ankle. You don't have a lot of it, and you probably don't. You could turn you ever sprain your ankle? No? You're lucky. This is really mobile. You can turn your foot in like this. That's why everyone sprains their ankle this way. There's a lot of mobility here. They don't sprain their ankle the other way. It doesn't move that much, right? So what you're gonna do is you're gonna turn the foot out and then pull the toes up. Remember, the calf primarily lifts the heel. You can stand on your toes with it. But this muscle does that too. So if this flexes the muscle, this must stretch it, right? It lengthens it, it stretches it. All right, so here's what we're gonna do. I'm gonna push gently to your tolerance. You're gonna turn the foot out like that and then pull the toes up. And you feel under my thumb.
Yeah.
You feel that bad boy?
Yes.
Come back, out, and up. Am I pushing too hard? It's not fun. This isn't fun, but this is incredibly necessary. So again, out and pull your toes up. You feel that thing pulling on my thumb.
Yeah.
We're loosening the muscle. We're getting all that grit out. It's going to alleviate tension where it attaches here. I can't quite remember the bone. Maybe the navicular. I don't remember. I gotta go back to my nerdy books. But when we alleviate tension here, or the adhesions in the muscle here, it alleviates tension here. This is remarkably common. This can hurt real bad, right? Real bad. Where you're limping when you have pain on that attachment. But all this will loosen up, and you won't have that pain anymore. This muscle goes behind the ankle and supports the arch of the foot. All right, let's do the other one, because the other one's worse. All right, the other one's worse. Now, Tiana here
This foot's ugly.
is an ugly foot?
Yes.
It's not video worthy?
No.
All right.
Look.
What's wrong with it? Oh, you got your toe.
Yeah.
Little bird thing. It's
Yeah.
okay. That's cool. You're not a foot model. We're not showcasing slippers here. All right. So, like I said, it usually presents here, like the size of a credit card, right here. But there can be cases where it's this low, and in this case, she has it here. It's right. I mean, I just palpate. I feel it around, and it's right. It's right in here.
Yeah.
It's right in there. It's where it just gets steak, like overcooked steak, and nobody likes that. Nobody likes well done steak, right? So we're gonna do the same thing. Let me know if I push too hard. Kick that out, and pull it up. Pull the toes up. Oh, that's beautiful. This hip has not a lot of mobility. You're able. I mean, you're able to. Here. Put this leg over this ankle right here. Look at this. You can drop this hip down. You can drop this knee down. It's almost touching the table. I notice this immediately. Here. Does not go nearly as far. I'm trying to just move her leg over so I can give her enough space to pull up her foot. We got to work on IT band, hip flexor. Oh, you guys all kinds of stuff going on, right? So right there, we're on it. Pull the foot up, pull the toes up towards me. There we go. The muscle's a little bit thinner as we move down because it's turning into a tendon. It's thicker up here, right? So there's less meat out and up, and this is something you can do. Come back. You know, she got the ugly face going. Yeah, it hurts. I do this to myself all the time, and this is what you do, and that will alleviate all this. It'll fix the issue. I've seen it a million times. That's all it is. Any questions?
No.
Great.
Thank you.
How often does she need to do that?
Do it multiple times a day. You have to do like maybe 8 to 10 passes, 8 to 10 reps, whatever you want to call it, reps, pass, whatever, and do it multiple times a day, especially after you've already worked out. It'll be loose. The muscle will be warm. You can mash it around a bit more.
Okay.
All right.
Thank you.
You're very welcome.
Are you gonna do that?
Yes.
All right.
I know.